Hello and welcome to tonight's webinar on Healthlink and SR specialist referrals within best practice. Thank you for taking the time to be here this evening with us. So my name is Alaouie. I am the Digital Health Coordinator here at Sydney North Health Network. Before we begin, we wish to acknowledge Australia's Aboriginal people as the custodians of this land. We pay and recognise their unique cultures and customs and honour their elders past, present and future, and extend that respect to Aboriginal people attending tonight. So just some housekeeping rules. Your microphone and video will be disabled during this webinar. We would love to hear from you tonight, so please use the Q&A option at the bottom of your screen to ask any questions and send comments to our panelists. If you see a question that is of interest to you, please feel free to give that a thumbs up, as that will move the question up. Therefore, it is more likely that we can answer it during this webinar. We will do our best to answer all your questions as well live during this presentation, as we have dedicated a Q&A section at the end of the presentation as well. It is also possible for participants to interact with each other using the chat function. And if your screen freezes at any particular point, your Wi-Fi connection may be limited. So just try moving closer to your Wi-Fi router. Also, just a reminder, at the end of the webinar, there will be a short evaluation for you to complete as well. So just a overview of tonight's presentation. So I'll just be giving a brief introduction to the digital health team at Sydney North Health Network, and then I will then hand over to Carmel and Nicole to go through their presentation for the night, which would provide you an overview of SR specialists and e-referrals, and then a dedicated Q&A section at the end. So just before I hand over, I thought I'd take the opportunity just to inform you a bit about what the digital health team at Sydney North Health Network do and how we may support you or your practice. So we essentially provide free support to health services and healthcare professionals just like yourself relating to digital health systems. So some of the digital health solutions we provide support and training with include telehealth. So we are still continuing to register practices with Health Direct Video Call, which is a free platform for you to use to conduct your telehealth consultations with patients. We also provide support with the My Health Record, which is an online summary of your patient's key health information. So we can help you get connected if your practice isn't already connected, or just even provide you with training on how you can use systems so that you can access your patient's clinical information in a secure and timely manner. We also provide support with secure messaging, electronic prescriptions, and the digital health guide. So if you would like any support or training on any of the digital health systems that I've just mentioned, please feel free to contact the digital health team on the email address below on the screen. So that's digitalhealth@snhn.org.au, and someone from the team will get back to you. So welcome to anyone who has just joined, and I will now hand over to Carmel and Nicole for this evening's presentation. Thank you.
Hi everyone, thank you. I'm Carmel, this is Nicole.
Hi.
And tonight we're going to introduce our service SR specialists and referrals to you. This has been live now for several months, and it is live in your software. You don't have to do anything to set it up. You can go straight into it through Healthlink, so it's already fully live through the Healthlink system. The service has been live in New Zealand for a number of years, and we've had over 700,000 referrals sent through SR in New Zealand, and it's steadily building now across Victoria, Tasmania, New South Wales and ACT. It's based off our printed directory, so for many years we've actually published the medical specialist directories. We're over 20 years in Australia now, and so all of that database of the specialist information that we hold has been linked up with the Healthlink information around the delivery of referrals electronically, so that you can look up any specialist, and where they are live for electronic, you can send the referral electronically. Where they're not yet set up for electronic, you can still see all their information and complete the referral process. But for those ones, you'll see that you'll need to send the referral manually, so it actually tells you in the service the difference. But that's sort of a very brief intro, and now Nicole will start guiding you through it. So we'll do our share screen and take you onto it. Yep, so here's our screen. Hang on, just click share. And now go down to...
Hi, sorry about that. So we're in best practice, and here you are. We opened our test patient Donald Duck at the top here. And if you are looking for specialists and referrals, you need to go to view and find Healthlink Forms. And if you click on that, all the, then here, that's your new form. And all the Healthlink forms will come up. Now, many of you will know Transport for New South Wales, where you do your driving, medical, my aged care, but we're right at the top here, and we're for private specialists and referrals. So if you click on that, the directory comes up, and then you can search for who you're looking for, either by category or by name or by region. So here's the medical specialist directory. And we'll just search by category at the moment. Let's try, let's go here. Cardiology is quite a large one. And one of the suburbs, let's go for Chatswood. Click there, search specialists and see what comes up. Now you can see we've got some groups that have come up and some single specialists that have come up. Some are alive for electronic referrals at a few locations. And something like this, whoops, is just manual refer, so that it still shows all the information, the specialists that are there, but not, this is not going to be good for us to do an electronic referral. So if you go here to Sydney Cardiology, you can see a little bit of information about them, some of their specialists, where they're based, and if you could send a referral straight to the group, and you can choose the location there, or you can choose a specific specialist that you know, or you know what their specialization is, and then you could send the referral. As you can see, he actually belongs to more than one group, and so you'd have to send a fax at the one location and electronic referrals at the other location. Now, the great thing about this is no matter whether you click manual refer or choose a location for the referral to go to, it's the same form. All that happens at the end is you either print it out and fax it, or you hit the send button and it gets delivered electronically. So we are not going to send them a referral because this is absolutely live. What we do have is we have got our test specialist, who is Mickey Mouse, who is a psychiatrist. So we can just search him up. And here we've actually got Mouse Services and Mickey Mouse and Peter Mouse, but we'll go for Mickey Mouse over here, and we still need to hit search. And here he comes up. So we are going to do this address because that's the one I want. And when that form comes up, I can show you a little bit more about the form.
So it's very similar to the other Healthlink smart forms. They all have the same structure and the basic outline to them. So once you've got familiar with using one, you'll find that it's easy to use the others as well.
And the big thing about this actually is that you do not need the EDI or the delivery address. That we do all that in the background. Once you've chosen the specialist and you've chosen the location, the referral gets sent there. So you do not need to update your address book and keep checking if anybody's moved. So if you look at the other Healthlink forms, they're pretty similar to this, and the patient information all gets pulled through into the form. You've got your referral over here, whether it's going to be 3 months or 12 months. We're going to flag this one as urgent. What we have to do here is there's a little red dot there. Oh, do I need to fill that in there? I do have to fill something in here. If I do not fill this in, it won't get sent. We do actually need a reason for the referral to be sent. And the urgent description is, needs help. I'm sorry, actually the specialists really do not like it when you put something like needs help in that box, but I couldn't think of anything. So we've got the basics that have been pulled in there. What you could do as well, you can check your consultation notes and basically pull something in from your notes or copy and paste from something else and add it in there. So the next thing we've got is reports and attachments. Now we do have the files that are accepted over here at the top. There are other files that do exist, but these are the ones that are the latest, the ones that most people use at the moment. So what I would like to show you is I have actually got, so I've done a lot of referrals. So all the referrals automatically get pulled into the patient's file, but I'd like to add the full blood count and just add that. And then I also want to browse for something from my computer. So if I click that, and I do actually know this name, so I'm just going to type that in, and oh, X-ray. I'm actually going to take that and upload that to the record as well. Now, if you look up to the top here, we ticked that attachment. And then when we got something from the file, it's actually listed in a separate section over here. And the reason I'm showing you these is when the referral gets delivered, it doesn't actually come as a separate attachment, but I'll show that to you a little bit later when we actually get the referral. So over here, this test patient doesn't have much, but all your medications would automatically be brought in. If you thought something wasn't relevant and would maybe cause privacy issues, you can untick it, but generally everything is automatically there. Again, medical, social, nothing's automatically ticked, but if you think something's relevant, like alcoholism or something like that, you can click that in. Patient information, this all pulls from the patient record again. I do not have a state here because he is all over the place. And then this is my information that automatically pulls through. So what I would like to do is preview this so you can see what it looks like before sending. What? Okay, so the preview's here, and you can double check what you've done. And then if you do want to make any changes, oh no.
Here we are.
And if you do want any changes, you can see it pulls out in a nice, easy to read PDF, you know, bright color red over there. It lets you know that it hasn't been submitted, so you can still submit it from here instead of going over there. Everything's pulled through nicely, except the X-ray just shows you that's coming separately, and the master full blood count doesn't come through here. So I am going to close out of that and actually submit this over here. You do have the option of parking and finding more results at a later stage and adding them to the referral if you're tight on time in the consultation. So we're going to hit that over there. It does take a few seconds to show that this has succeeded. So now we do have the time stamp that this referral was sent. Some GPs do hit print and print it and fax it as well, or give a copy to the patient so that the patient can call the specialist, because the specialist details are on here. So up at the top, the patient details are over there, and the GP details are at the bottom over here. So all the details are on the referral form.
The specialists actually really like the standardized format of the referral forms because they get familiar with those and it becomes easier for them to just quickly pick up the key information. And yeah, it's just a more structured approach. And because this referral form is going through Healthlink, you don't have to worry about looking for a template or updating templates in your local software either, because it's all managed within the Healthlink referral form. So there's no requirement to reference different templates for different specialists or any of that sort of thing. They all have the same standard format, and it's just part of the standard process. So that simplifies things from both the GP and the specialist end as well.
Now, I did want to show you how this referral comes in at the specialist side. So I do have a portal, that's why I use that second address. and it hasn't come through yet. So there we go. Perfect. It has come through now. So this is the referral that we just sent. And sorry, there we go, looking at that. So you can see this looks like the PDF that we saw as the at the preview. But what's different here is the X-ray has come in and the blood count has come in all in the same referral. So it's one document. So nothing's going to get lost as a separate attachment. And when the specialist does make it, this is a portal account, this isn't actual software, but if the specialist has Genie or any other software, usually they can use this referral and make the patient record straight from that referral. The referral letter will be in that patient document, as well as the X-ray and the blood tests. So that's basically what it comes like at the end. So you can see it's actually really, really neat, really tidy, and nothing gets lost.
So a few other sort of general context points around it. In terms of the specialist receiving these referrals, there's no cost to the specialist to subscribe or to have the referrals come into their software. If most specialist software is compatible with Healthlink, so most of them can have it set up to come in automatically, like Nicole was just saying, and have that added benefit of the option to create the patient record, which obviously saves on admin time at the specialist end. The ones that are on less common software that may not have that integration option have access now to the portal account, which is a secure browser-based access. So that's what we've used here in this demonstration to show you how the referral looks at the specialist end. So either way, most specialists do have the ability now to subscribe and access their referrals electronically through this medium. And by and large, they do prefer this over fax because it's obviously got the advantage of there being the more secure transfer and also the confirmation back between the systems as well that the electronic message has been delivered. So that's another piece we can show you back in the GP side now. We'll just flip back to best practice. And Nicole will show you where to see the status of the message.
It's here.
Yep. So you can see in the, is it in the up box? Can you form?
Sorry.
We're just navigating.
Sorry about this. I actually don't know best practice 100%. So just trying to find the patient.
Might need to minimize the other window behind.
I'm just going to drop this down.
Yeah. So we can see.
Good.
Now we can see where we are. Makes it a bit easier. We're just navigating around our windows because we're on a smaller screen.
So here we go. Here's the patient record. Today's notes. Oh no, there's no notes. Ah, correspondence out.
So here you can see all, Nicole's been very busy doing lots of test referrals for people. So that's where we can see the referral going out. And then there'll be a place to show in Healthlink the status of the referrals. So you haven't seen that? Oh. I know we looked at it in medical
director. I'm so sorry. I do apologize.
So here, the status here, auto-saved completed, is that part of it. But there should also be the ability to see the acknowledged, just what's that next folder?
Please. I do apologize about this. Yeah.
We've glitched.
No, totally blanked.
We know it's somewhere around very close. So just we might carry on and just cover off some other things and come back to that in a little bit. We'll just have a quick recce on that. What was the other? So in terms of other functionality, if we go back into SR and just show you some other ways to search and to navigate in SR for the specialists.
So I'm just opening the test patient again.
Yeah.
So we don't accidentally do anything strange. So there we go. So for private specialists and referrals. And I'm just going to make this a bit bigger. There we go. So
if you know the name of a specialist that you're looking to refer to, it's a good idea to start typing the name in the drop-down list. So if I've got John, and then it brings up a list of everyone that matches, but if I make a typo, obviously I'm going to have less names. So it's always a good idea to look at the drop-down, because sometimes the spelling of the names can throw people off, and you can end up not finding the specialist just from a spelling issue. So the actual drop-down list is quite a good way to narrow down and then obviously go into who you're looking for and see a smaller subset there. So that's one tip, so that you don't get caught, particularly with names like Bill and William and abbreviations and things like that. It just helps to use that drop-down to get the names found. Once you're in a category, we've actually grouped the categories, you'll notice. So gastroenterology related, if you go into that in a general category, you'll then see subcategories on the side here. And you'll see gastroenterology shows up again, and that's still the main category, in fact, in that section. But then there'll be other smaller categories that you can go into as well that are more specific. So what's happening here is the specialists are explicitly saying that they want to be found under this area, and that's why they're being included in this set. So that's quite useful for narrowing down, or if you have a particular search that you want to do. So in all of the areas, there's the subcategories that you can navigate to. If we just go into dermatology related, and you'll also see, once you're in an area like this, that if you change the selection that you've made here, so if, for example, we go across to, say, varicose veins, the other subcategories that display have also altered. And that's sort of just help, guiding you really as to what's related to this category that you're looking at now. You can also see your recent searches and your recently viewed profiles. Another key feature is that email to patient. So what happens here, should we go? So this enables you to send to your patient the profile and the contact information of the specialist that you're referring them to. So it's quite a handy tool, and all you need to do is drop in their email address. So if I drop in Nicole's here, and we can show you Nicole at, yeah, if you type, yeah, it'll be quicker. So we'll just quickly do that now. So you could do this yourself to see how it comes through on your end, but it's quite handy for patients to be able to be given this information. So as a GP, you can either print off the profile screen that you're looking at, or you can send them that email. It doesn't go from your personal email, it goes from the SR email server. If we flick across, Nicole, can we do that to your emails? Is that handy? Just flick across and we should see.
It'll take a minute.
Might take a moment, but it'll come through in their email, and then if we could flick over to health pages and just show them that. So what it's linking to is the public website that all the specialist information is available on. Okay, I'm going to just flick across to another.
Okay, on health pages.
Yep. So this is where the email's going to be pointing the patient to, and it will go directly into the profile record that you've sent them. So on here, they can search on a name and just, so it's the same database behind it, even though it looks slightly different here. So if we just bring one up.
Yep. There we go.
So this won't probably be one with a photo, but it'll give you the idea. So it goes straight in. So when there's more information, obviously that will display as well, but this also has their contact details down below. And if they're bringing this up on their phone, they'll just click on that phone number and be able to dial through and make their appointment. So from a patient convenience point of view, that actually works quite well.
I'm going to go back to the email.
Yep. Yes, now it's come through.
So the email has come through. Your GP.
So it would normally be your name, but because we've set up our account as a test account so that when we send people tests, they know it's not a real referral, showing test referral there, but it would normally say your name, sent you the profile and contact details of the specialist name, and then they click on that and straight into the specialist information. So that's the idea behind that part of the service. And of course you can print it as well. Just go back in here. So a part of our service that we're providing is that it's not just about having the on-screen functionality. Behind the scenes, our company is very active in supporting the specialists. And so one of the things that we have a team doing is each day as the referrals go through, we see a log of the referral traffic that's going through. We don't see any patient information, but what we're looking for is specialists that are receiving an electronic referral for the first time. And wherever that's occurring, we are proactively phoning those specialists and talking to their staff and making sure that they know where in their software to view that referral and helping them if they've got any queries on that. And we can see the ones that haven't yet acknowledged the referral back to the GP. So when, or haven't yet actioned that referral at their end. So if the referral hasn't been actioned at the specialist end, then that's also a clue for us that they may need follow-up. And that follow-up side of the work we're doing is actually really important, because obviously as a GP you need confidence in knowing that yes, the specialists are getting these referrals. If you find that you have any sites that you're sending an electronic referral to and then you get a phone call saying please fax it, by all means let us know. Down the bottom here is our email address. Just scroll down, Nicole. The SR support email address. So any queries from your end, flick us an email and we're more than happy to follow up and offer training and support at the specialist side if you think that they're asking for a fax when you know they've sent it electronically and they should have it. That sort of hand holding at the specialist end is actually really important, because a service like this, when it's new and a change of behaviour, sometimes just to help it work more smoothly actually needs people talking to each other. And so that's something we've actually done for many years. We've supported specialists, and so we're doing a lot of support now and helping guide them in the process at their end to make sure that they're comfortable receiving those referrals and know what's going on. So that's just something else. What else have we got that we can show you?
I think
that's probably enough from us.
Yeah, it was way longer than I thought.
Yeah, so we're very keen to have questions from you now in terms of.
All right, we've got our first question from Will. What happens when a patient wants a choice of 2 or 3 specialists and asks, say, 2 referrals? Does the GP get specialists calling to wonder why the patient never turned up?
Nicole,
I'm going to take that one. It honestly depends on the specialist practice. So, there's 2 very different scenarios. One is they receive all their referrals and they do not call any patients because they don't want to waste their time. And when the patient calls in, they either look in their software or they pick up the fax and they type everything up into their database. And the second, the more proactive specialists actually do take the referrals and call the patient and book them in. And if you do give the patient 2 referrals to different specialists, maybe the one who calls will get that patient. That's all I can say. But you know, I've spoken to a lot of people who say, you know, when they knew getting electronic referrals, they are not so sure about them because they're worried it means they have to call the patient. But then some people go, oh no, I've just got it here. I know when the patient calls and I can't find the fax, I look in incoming letters or whatever the equivalent is in their software, and then they find the referral there. So it depends on their flow.
It also depends how busy the practice is. So practices that are super busy may be ones where they're more comfortable waiting for the patient to call in before they book that patient in, and others that perhaps are newer practices that aren't as full are likely to be more proactive in terms of following up with patients. The other thing that you can do is use that email to patient and let the patient, you know, give them some suggestions, and then once they've done a phone around perhaps and made their own choice preference wise, timeline and anything else they're looking at in regards to convenience for that specialist, then they might say, oh, actually, this is the one I most want to go to. And then you just do the referral to one of the specialists based off patient having already looked at some options. So that's another way you could handle that situation.
Okay, I guess that perhaps leads into another question. If you do have a patient who you need to do an urgent referral,
Yes.
Is there a way that perhaps you can handle that?
Yes. So on the referral form itself, if I just go through again, I'll be very good and I'll use this one, but I won't click submit because I don't, well, actually I'll do a manual one because that doesn't matter. So on the referral form itself, you can choose to flag it as urgent, and that's how, and when you do that, it flags it both in the referral document that goes through to the specialist, but it also flags it in their software system in the list. It's flagged as urgent as well, so they don't have to wait till they open the referral to see it's urgent. They can actually see it in the list of incoming letters or in the portal display screen of the incoming referrals. It'll be flagged there as an urgent one, so they're always clearly identified. So this is the urgent flag on the first screen, and you do need to type that description in, so some rationale for why it's urgent is obviously going to be helpful.
And the second option is to actually phone the specialist practice and let them know and ask if they can actually accept urgent people. Yeah.
Another thing that we also do, I'm not sure off the top of my head of the example, but you'll notice on some of the, I'll just park this one, on some of the profiles of the specialists, they sometimes choose to note available for urgent appointments. And what that means is that the specialist is actually signalling to you that they're keeping some appointments aside so that they can take urgent cases. And you can refine, I think you can refine your search by that as well. Yeah, just go back to that. So back on our search screen, pretty sure we've got refine by urgent appointments available. So that can be useful as well. Oh, we've confused it by clicking too many buttons. Hang on. We'll just close some things. Just try now and open them. I think because we were in one and we backtracked.
And I think we've just got some people who joined a little bit later, and I just might mention, if anyone has a question, you can type it into either the chat box or the Q&A box. So don't hesitate to ask a question if you've got something.
Maybe we should.
So here, urgent, at the very top of the list, urgent appointments available. And so that will refine the list, the ones that are specifically saying they've kept urgent appointments available. In terms of the information that you see there on the specialists, all specialists are included in the service that are in private practice. So if you know a specialist that you can't find that you think might be missing, by all means flick us an email and we will contact that specialist and make sure we get their information loaded, and there's no cost to that for the specialist for that. The specialists that choose to can include more information about their services. So maybe just go into one of those there, Nicole. And what they're doing here is they're actually giving you more guidance as to exactly what they do provide, and that's generally helpful, particularly in areas like orthopedic, where obviously they're not doing all parts of orthopedic surgery. A lot of them do specialise in a particular area, and so you'll see more information about their specialties coming through here. And that's just to make it easier for you to find the right match for your referral. We do display those that have featured and they're paid for that service. We do display those ahead of the ones that don't provide any information about exactly what they do. So everyone's there. But you'll see the featured ones above the ones that don't. And that's our model, basically. That's what supports the service, is the specialists that choose to provide more information to make those referrals easier for you, the quality of information better. Yep.
And I guess the other question that perhaps pops up a bit is, I guess from Sydney North Health Network, one of the things that we really liked about this service is that for the GPs, there was a big headache trying to maintain an address book in best practice with up-to-date EDIs. We sort of, in terms of the region, that you can have specialists who might work at a hospital and then they stop working at that private hospital and work at another one. So would it be correct that you sort of track all those changes and so on?
So because we work with Healthlink, Healthlink gives us all the EDIs as they get updated, and we change them daily. Yes.
So there's two things happening there. Healthlink are feeding us their new EDIs or any changes in the EDIs. We are also proactively in contact with the specialists, and so as they tell us they've moved from one centre to another centre, and we know that that other centre has a different EDI, then we update that individual specialist information to the new EDI at the new address, so that it doesn't end up going to their old centre. And it is also very common for the specialists to be spread across multiple locations, and that could be multiple different EDIs. And so we have matched their data at the address level to the correct EDI. So we're managing all of that legwork for you. It's a big job for us, but it's core to the service working, and it's the ability for us to drill down and get that address delivery information correct, which really creates the benefit to GPs and specialists, and that's what's worked so well in New Zealand, and we're sure that giving the ease of use and the accuracy of delivery is going to be a very useful tool for all the GPs and specialists in Sydney and throughout Australia as well.
Yep. And just just to clarify that all the private specialists in the region and indeed New South Wales are in the
yes,
in the directory. Yeah.
Correct. Yes, and their organisation. So when you choose to do a referral, you can either refer at the organisation level for the organisations that take referrals under the organisation umbrella name, or at the individual level. So you actually have the choice either way, depending on who you choose to address the referral to. If you address it to the organisation, then it may be more likely that if there's a group of specialists there, they'll divvy it up to the one that's available soonest. If you address it to the individual specialist, then you might be choosing the particular person that you know has a particular specialty in the need that your patient has. So you're targeting who you want to look after the patient. So you have that choice in where you send the referral. You may see the odd organisation record where the e-refer button's not showing, and that's because we've actually turned it off, and that will be because the organisation has said, no, we do not accept organisation referrals. You must only send it to the individual specialist. So where that happens, you can bring up the organisation page and then link through to the specialist and send the referral there.
Okay. I think we've got quite a few GPs on the line. I'm not sure if we've got any other questions, but I think just some of the feedback we've had is that it's quite difficult to maintain that address book. I guess one of the things is that we should just emphasize is that this is free for the general practitioners.
Yes.
It's free also for the specialists.
Correct.
And it's only for the specialists, they have the option of paying if they want to have some advertising and so on. Is that correct? Yeah.
That's exactly right.
Yeah.
Yes. So the ones that are choosing to put that detailed information in, that's supporting this service. But we do cover everyone, and the reason why we cover everyone is that it's really important from a referral point of view and from a efficiency point of view that if you're looking for someone, you want to be able to go to one system and do that referral. You don't want to have to guess which system or which template or where to go to look for the specialist to do the referral. The goal of our service is that you can always go in and complete your referral to a private specialist, and whether it be electronic or manual. So obviously we're working hard with Healthlink to register more specialists all the time so that the number that are e-refer is steadily growing.
Yeah.
And that's a key part of the development of the service going forward. If you know of particular specialists that you are referring to regularly that you'd really like to do as an e-refer and is currently sitting as a manual, by all means, flick us an email on that, and then we can go to that specialist and say, look, this GP who's a regular referrer for you would really like it if you tried the service. And we're happy to play that go-between role because it's only going to make everyone's life easier. But sometimes people do need a bit of encouragement to realise that it is a tool that's now being used more, and to just find out for themselves the value of that. So, yeah.
And we've just had another question come in, so I'll go through them one by one. So first one was Samantha. Landa, and she's asked, could you please go over how to access the e-referrals from best practice again?
Yep.
So I
Okay.
think she might have missed that
Yeah.
that first step, and
That's
I
all
guess
good.
also trying to make this a habit and so on. It's good to have that reminder. I know I've used best practice a lot at times, and I've been surprised that I forget where things were,
Yes.
even though I used it quite a bit. So I think that's a great question. Thank you, Samantha.
Actually, it's in here. I think that Houselink page that we were looking for. Just go clinical.
Oh,
No.
sorry.
We'll come back to something else as well. We're also learning best practice more as we go. We've been mainly on medical director
Oh,
just
yeah.
lately.
And while Nicole's accessing that, I might ask this other question. So Jackie's asked, will this be extended to include allied health professionals at some stage in the future?
Possibly is the answer on the allied health side. We have just expanded that in New Zealand, so that is a possibility. One thing that we have found is that it's becoming more common for a number of the specialist organisations to be working more holistically with allied health providers under the umbrella of the one organisation. And where that's happening, any organisation that has at least one specialist associated with it becomes part of this directory. So as long as there's a special, so what that means is you could be sending a referral through to a dietitian that's associated with the gastroenterology group.
Okay.
Or a physiotherapist associated with a gynecology obstetrician group now in terms of pelvic floor exercises or whatever. So there is already that overlap starting to happen.
Okay.
And we see that developing more and more as specialists themselves see the benefit of working with other providers and meeting patients' needs. So that's a trend which is going to continue to develop, and our directory will, I'm sure, grow with that as well.
Okay.
Okay, so I'm back in the patient record, and we go to view, and there's Healthlink Forms there, and we click on Healthlink Forms, and then it's the blank page for a new form to come up.
So this is instead of going to find a template.
Yes. I think I might be clicking to things too quickly today. And that's where the form comes up, along with the other Healthlink forms. So that's us there.
It's in the same place as
Specialists
the
and referrals.
transport one and the aged care one. So we're in that area of the system. And then I click on that, and that opens the main search page. So you need to go into the service via Healthlink, and then what we do is we talk to Healthlink. So once you've chosen the specialist, then we pass that information to the Healthlink form, and Healthlink's part of the system is to actually pull the information from your patient record into their form, and then the delivery goes back through Healthlink into the specialist software at their end.
Okay,
So
that's great.
It's quite seamless there.
We've got another question just come through from Heather Knox. Some of our attachments seem large. Is there a limit or way to make the size of the attachment smaller?
Yes.
PDFs are probably your best bet because they're not too huge. We have had problems with referrals not going through once they are over 4 megs, but just try.
Yeah, so we are tracking that. So in the log, if a referral has a problem, then it is flagged as having an issue. And what's happening there is any instances where that's happened, it'll see in your end of the system that the referral hasn't yet been delivered. So you'll actually be able to see that. And at the specialist end, they may not receive it, but what happens there is either if you've spotted that in the log, you can make a request, but also because it's a new service, we're actually following up with Healthlink support to check, what's happened there. So in any instance where there has been some reason that it hasn't gone through, that's an area that's actually getting looked at as part of the support role that we're playing as well. Now, I think we may have just want to navigate back to Healthlink, the main screen. And back to we're just going to have a quick look across the Healthlink menu bar up the best practice menu bar across the top, because I know that no utilities, no view.
And
Yep.
we've got
Okay.
one other
Yep.
question, just perhaps more of a clarification from Amanda.
Yes.
She just wanted to just clarify how the system was funded. So it was free for the GPs, free for the specialists?
Yes, so from Healthlink's point of, it is free for the GPs to use, and it is free for the specialists to have the referrals through this and to register with Healthlink for receiving referrals through this service. So it's definitely free at both ends. As I mentioned before, the specialists that choose to can include more information and they'll pay for that, other than the base information of, you know, they're an orthopedic surgeon and this is their address. On the Healthlink side, if the specialist wishes to reply back to you using Healthlink, then they can subscribe and pay for that reply back service, but there's no cost for them to receive the referrals through this service. So that's part of really building the usage, because obviously the more that people become accustomed and familiar to doing things electronically, then the more the other functionality that can grow as well. So that's how it's funded at this stage.
And the directory was around for a number of years before this.
Yes.
And was that the similar sort of model that you could have the standard listing and then there was the one with a picture?
Correct.
And so on?
That's right. So we're still publishing the directory. We're currently working on the 21st edition for New South Wales. That's in production at the moment. So we're updating specialist information. We continue to print in both, publish both in print and online, because we realise that not all specialists or GPs have access to all the online tools. And there's also something very tangible about seeing the printed directory and the depth of the data that we're publishing in that printed format. And we find that a number of GPs still like to flick through and refresh their memory as to who they're looking for and then go through and do the referral electronically. So we're just continuing to support whatever tools GPs and specialists find most useful in their day-to-day practice, be that print or online.
Okay. Well, I think we've run through all the questions. About the only other one that I think that we've come up in one of the other presentations was, if a specialist doesn't have or can't accept e-referrals, can you still use the system for faxing?
Yes. So that's the manual one. Perhaps we'll just go through that again and show the message that you get.
Okay, so I'm just going to find the Healthlink form again, and we're going to do a new form, and then we'll search something up once we get to it. So there we go for private specialists and referrals. I'm going to make that bigger quickly, and we'll just choose OBGYN's, usually quite a big one, and I haven't chosen an area. Let's see what we've got here. So Sydney Urodynamic Centres, manual refer, they've got lots of locations there. Let's just click on that. And you can see here, it's got all the locations. The only reason you would choose the location is it would come up on the referral as one of the group locations. And you could just make a referral here. So I can actually send a referral to the group here or choose one of the specialists. I'm going to choose Newtown because that won't go through to them. And you make the referral in exactly the same way, except you cannot add attachments. You would have to send those attachments. You'd have to print those files out, or PDFs or whatever you need out separately, and then send them along with the fax, because we can't fax attachments. So here it goes, only e-referral support attachments. This recipient is unable to receive referrals electronically. Manual referrals do not support attachments. So I'm just going to and then I can't attach. I can try, but can you see I've got no options to fill them in? Whoops. Same thing, I need to just put the postcode in here, and I can do a preview. And when I do a preview, usually you saw earlier that we can do the submit. There's no submit button over there to send the preview. Okay, and if I try do that, So it now has it as a PDF. And then I would open that and print that PDF and send it off by fax. Or I could attach that to email. Not supposed to do it, but that's the other way people send referrals.
Right.
Obviously, we don't. The whole point of this is to provide a better alternative to email.
Yes, so the plan is to fax it. But that's what you would do. So you'd have that same referral that you could then print out and give a copy to the patient or send by fax.
The only other question I was perhaps going to just pose to you, because as the PHN, we sort of had a look at creating individual templates for different organisations, different specialists, and that in itself is quite a difficult thing to keep and maintain. And there's also, you've got to create these as special documents and so on. So it's a real headache, I guess, as well to try and manage those templates. Perhaps, I guess some GPs might have set up templates and things that they like. Could you perhaps comment just in terms of having a standard template versus a GP created one, if there's been some feedback around that?
I think that obviously not from a specialist point of view, or from, well, I'll start from a GP point of view. From a GP point of view, not having to go hunting for a different template for different organisations and then having issues of those templates becoming out of date, that whole issue is bypassed through the service. So because it's a standardised form, you don't have to go and look or maintain the template set. So I know in the past, when you've had tailored templates for organisations and there've been updates to that, then that has to be uploaded at each practice and set up in their software. So you're avoiding that admin work, basically. Yeah. In terms of the information, Healthlink's worked very hard to make all of the patient record accessible through the form. It doesn't give the same sort of tailored personal letter presentation that some GPs may have set up their own template that they're accustomed to using. But the advantage from a specialist end is that because the information is coming through in a structured, consistent manner, it actually makes it easier for the specialist to process that information, to absorb it and to read it and to be looking at it consistently. And also particularly the benefit to create the patient record as part of this process. That's actually really significant, not just from a time-saving point of view, but also from an accuracy point of view, because it's actually importing the relevant information and there's no issue of it being miskeyed or misread or any of those sorts of issues are bypassed through having a more automated process. So there are definitely benefits at both ends to having a more standardized approach.
Yep.
Yeah, so.
I do speak to the specialists quite a bit, and they do sometimes comment that there's not enough information on the referral, but that is not due to the form. You can type in the reason for the referral and you can still go underneath it. You know, they've had a heart attack or something has forced you to send them to the specific specialist. So just sending the referral, yes, it might be standardized, but you can add all that information, and the attachments you add can really help the specialist find out why they have been referred to that patient, and also make a decision as to whether they're going to accept that patient or not, because not all specialists accept all referrals.
Okay, and we've got a question just come in from Samantha Lander. Can you see the referral sent in correspondence out in best practice or only under the Healthlink forms?
You're gonna have to help me here.
Yeah, so I think you can see it in out. We'll just go down to correspondence out now. So these are referrals that have been sent out, and this is the latest one here.
I do apologize, we should have picked that up a bit earlier, but I'm just so used to using Medical Director because that's what I use most days. So let's click on that, and there we go. So
you
that's,
can go back into it through the outbox as well, so you can see exactly what they've previously sent.
Yeah, should I close that?
Yes.
So this was just today.
And the message referral sent and acknowledged, that is actually indicating that it's been delivered. If it hasn't yet been delivered, it's not going to say acknowledged, it's just going to say sent. So But we will I'll come back to you with some screenshots if there's anywhere else within best practice to view the log information around the status of referrals, because that's actually quite important, and we're just struggling in our version here to see that. Yeah.
I should just mention that tonight's session is focused on best practice. We've done a session previously and we jumped between the two, between medical director and best practice. So we thought tonight we'd try a session just best practice. So and I guess we can tell Nicole you're a more a medical director.
Oh, it's just what I'm used to using. It's simple as that.
Yeah.
I don't do too much. I generally send test referrals, so I'm not used to receiving referrals actually.
But I'm sure the audience has appreciated that. Just less confusing just to see best practice tonight. So hopefully that's worked well from the session. Yeah. I don't see that we've got any other questions coming through. I don't know if AO, if you've got any other comments or questions you'd like to add, but I think we've covered everything tonight.
We're also available during the day, so if any questions pop up, you can either email or phone through to us. We have a 1-800 number, and yeah. Yep.
And I might just mention that we work with Sydney North Health Network. We've been doing some projects working with specialists, and the specialists do say they'd like to see more referrals coming through electronically versus faxed. And when we talk to different specialists, some say they're now getting more by secure messaging than faxing. So I think that's really fantastic. So that's really some great feedback. And we're also going to be running a session with specialists as well, trying to show them this and improve the rate of secure messaging being used in our region.
Well, that's fantastic. Yeah. What we have heard as the system's developed in New Zealand is, as the specialists have become more used to seeing the referrals come electronically, it's improved the business process at their end, and they've become more proactive at following up patients as a result. So yeah, we're quite hopeful that we'll see a similar uptake in staff having the time to phone and be more proactive at contacting patients. So that's another advantage of sending it through electronically.
Yeah. Well, I think that we've covered. I'm just guessing from the questions not coming in that we've done such a great job presenting tonight that we've covered everything. So I think that was fantastic. So I guess we'd probably ask the GPs that are watching tonight, when you go back to your practice tomorrow, if you can give the SR referral a try if you haven't already done so, and try sending some referrals using this method. And I guess like everything, it just sometimes takes a few goes to sort of change the habits. We've, I think my colleague Aya's on the line, and she's been out seeing different GPs, and so many of them have been surprised when they've tried this system how much time they're saving. The other thing is just that it's just totally removing that headache of having to maintain an address book, so that those specialists who move around, change practices and so on, SR referral is going to take care of that headache. And also just to trying to keep your templates and things up to date. I think that's a real headache. So this really sort of solves two really difficult problems for GPs, and just sort of does that all in the background. So it just makes it a lot more seamless to send those electronic referrals. So thanks.
Yep. I was just going to add, you're welcome to send a test referral through to Mickey Mouse. So rather than send test referrals to real specialists, find Mickey Mouse and send it through on that one if you just want to give it a go. We're receiving those all the time, so it's perfect.
So I guess that might be the first thing you try tomorrow when you go back to your practice is send a referral to Mickey Mouse. How can you forget that name? That's a really easy one to remember. And then give it a try for your next referrals to specialists in the area. All right.
Thank you.
All right. Thank
you.
you.
So much. Have a lovely evening, guys. Bye-bye.
Good night.